How much sleep does a very reactive dog need? I'm Gabrielle Johnson, and I specialize in aggressive behavior and nervous system dysregulation. So, dogs with anxiety disorders, trauma disorders, hyper or hypoarousal, or chronic stress that may be resetting the baseline of their stress levels. These dogs often struggle with resilience to stress and often struggle with accessing appropriate coping skills to help them come down from higher stress levels. And sleep is one of the most overlooked components that I see in my client population. I will often work with folks whose dog is heavily sleep deprived. And they'll say, oh my gosh, like no one has ever brought this up. I didn't even think about how much dogs might need to sleep. And we don't have any hard science around how much dogs should sleep. But based on my personal experience working with dysregulated dogs, based on my experience as a pet parent, based on my experience as someone with lots of friends and colleagues with dogs, based on what I have learned from other trainers, behavior consultants, and veterinarians, consistently across the board, this is what you'll tend to find. And this has lined up with my experience in all of those avenues. Puppies through adolescence need about 18 to 20 hours of sleep per day. And when I say that this is what I have seen, and this has been my experience, beyond hearing this recommended from other professionals as well, I mean that when I see dogs in that age group who are sleeping less than that, things tend to change dramatically when we move them up to 18 to 20 hours a day. And often in my client population, these are dogs where we have to make some changes to help make that happen. There's something happening that is preventing them from getting that 18 to 20 hours of sleep per day. And we see a big dramatic shift. And so, especially with puppies and adolescents, check in on that sleep. Seniors over time are returning to that 18 to 20 hours. So your dog doesn't like turn 7 and suddenly start sleeping 18 hours a day. But we start to see an increase in sleep in seniorhood, back to that 18 to 20 hours. In between, in adulthood, we tend to see 12 to 14 hours per day of sleep. Now, if your dog isn't having mental health concerns, emotional health concerns, behavioral health concerns, physical health concerns, and they are a bit outside of that window, I wouldn't panic. But if your dog is having health concerns of any nature, emotional, mental, behavioral, physical, and their sleep falls outside of that range, I would see what it looks like to put their sleep inside of that range. Now, here's an interesting piece. When our bodies, our minds, when our nervous systems are working overtime all the time, as is the case for dysregulated dogs, whether that's chronic, like with the dysregulated dogs, or in acute situations. Maybe we have a new rescue dog. We've just adopted them, and they went from one lifestyle to a shelter, to a foster home, to our home. Even if the circumstances all along the way are what we would consider lovely, that's a lot of change that the dog had no control over and no insight into. Like just one day, their life is changing and then it's changing again, and they have to relearn all of these schedules. So whether it's acute or chronic stress, we may see a need for increased sleep. So often I do see that my clients are either undersleeping, and then that's something we want to adjust, or we might see that they're oversleeping. And of course, if they're oversleeping, we're of course checking for physical health issues. We're looking to see if this is related to like a hypoarousal or depression or a freeze type of response. We're making sure that this really is about sleep. But outside of that, we're probably going to let them sleep. They probably need that sleep. And we may actually see that need for sleep decrease as we get their stress levels down. And so if you have a dog who's experiencing chronic stress, and this is important because you could have a very reactive dog whose stress is well managed, and so they are not being exposed to those triggers, and so you may see that their stress levels are down considerably, versus a very reactive dog who's encountering their triggers regularly might have those higher stress levels. But we want to make sure that they're getting the amount of sleep appropriate for their development. And then we may not be surprised if they need additional sleep while they recover. Similarly to if we have, it's the joke of, right, you have to recover from going on vacation, right? Or if you've been sick recently, and then you kind of have to recover from being sick because your body's been working overtime to get better. Same sort of thing. And if you have an anxiety disorder or you have a trauma disorder as a human, or we know that autistic people often need more sleep because their brains and bodies are doing more, processing more, sometimes working on overload, depending on what we're talking about. And so, sleep is an important factor, and we really want to think about how it pertains to the individual and their experience in the world.